doctor.
For flexible cover that suits your individual healthcare needs.
Could this funny mole on my hand actually be melanoma? Do I simply have a minor cough, or could it be pneumonia, or worse, cancer? Too many of us turn to Dr. Google for a medical diagnosis and end up lying awake at night paralyzed with concern over the several hundred potential diagnoses of the stomach pain I have. Google knows a lot, but it doesn't know you, and it doesn't know what's true. The question I wanted to answer today is, once you've self-diagnosed yourself with stage 4 lung cancer, after you started coughing this morning, how do you decide who to go and see, your GP or a specialist? Varsha, let's talk about the complementary and the synergistic roles of GPs and specialists, and who's responsible for what.
The decision on who to go and see it starts at the GP, because the GP needs to see someone in context of everything about that person. So in other words, which community they live in, what is their genetic predisposition to a certain condition, etc. So the GP should be the first point of contact.
I couldn't agree with you more. We're not machines, we're people, and we're part of a complex, if you like, a community, say, which is great. In fact, I mean, you would know this, a GP knows a little about a lot, and a specialist knows a lot about little. And in fact, from an overall health perspective, it's a valid concern. Because of their narrow field of practice, specialists may miss other diagnoses through no fault of their own. Is there ever a justification, though, Varsha, for going directly to a specialist from a consumer perspective or patient perspective?
It ultimately boils down to, is it a known diagnosis? So has my GP diagnosed me with a specific condition? And then in the discussion with the GP then decides, hang on, this falls outside of the scope of my expertise, and I suggest you now need to see a specialist, and this is the type of specialist you need to see. And that is when the visit to that specialist is justified.
What about medical aids? Would they pay for a consultation with a specialist if there is no referral from a GP?
I think, Michael, it ultimately depends on what option a consumer purchases. So the medical aid is structured in a way that gives people choices. Medical aids have treatment plans in place for people who have been diagnosed with certain conditions, and within that, specialist visits are actually allowed without a GP referral, once again because it's a known diagnosis.
So the diagnosis must be confirmed.
Absolutely.
By a doctor, not by Google.
100%.
What are the financial implications of a GP versus a specialist visit?
I think if you look at it at face value, if you just compare the consultation costs of a GP versus a specialist, it can range from anything between double to 4 times the cost of a GP visit. But often what people forget is that a specialist, given his skills and his expertise, may want to run a big battery of tests, so different types of tests, which requires expensive technology. And those costs are also costs that need to be borne in mind when comparing when a person visits a GP versus a specialist.
We've talked about Google a lot, and we've given Google a bad rap today. What are the implications of this self-diagnosis on Google?
I think if I can best explain it through an example. If I am feeling a bit of chest pain and I turn to Google for what does chest pain mean?
Symptom checker, yes.
Symptom checker.
Yeah.
It could bring up a myriad of different diseases, and depending upon my mindset at that point in time, I may say, oof, actually I think I'm having a heart attack. Or it might be that the chest pain is just then a referred pain as a result of a bad case of reflux. I mean, I've overdone it on a hot curry last night and a bit too much of wine. And what actually then happens is that I put myself in a position where I feel that I need to make an immediate call in terms of my health. So either I go off to see the emergency unit at the hospital, or I try to get an appointment with a cardiologist. So what you're doing in actual effect is not only causing emotional stress for yourself, but you're already placing strain on a system where we know we have a scarcity of specialists in the country.
That's right. Certain people need specialists, certain don't, and you're crowding out those that possibly do.
Yes, and I think also, and from what we've seen from a medical aid point of view, is that when people actually make a self-diagnosis, 67% of the tests that are run come out with nothing. Yeah. Nothing further needs to be done. Now, if you actually quantify that into rand terms, let's say 100 patients have gone for gastroscopies. It could range from anything between 5,000 rand to 8,000 rand for that procedure. So if we take a small sample of just 100 patients, that is 800,000 rand worth of medical bills, which is completely unnecessary. Yeah. So the consumer might think, actually, I have medical aid, so it's my right to use it. But what we don't realize is that we actually pay for that in the form of our premium increase the following year.
My premium is increasing because you're going for the gastroscopy, in other words, is what you're saying. I mean, by all means, educate yourself and do a little online research, but then ask your GP for his opinion rather than demanding treatment for your own self-diagnosis. You talked about scarcity of healthcare in this country. Varsha, and you're right. 74 doctors per 100,000 people, where in the States it's 247 doctors per 100,000 people. How are we addressing that issue? I mean, what's the first point of contact for an average South African when they want to get into the healthcare system?
I think if I can place it in context of the numbers that you've just shared now, just to think about the fact that there are over 49 million people in South Africa. And if you look at the number of GPs that we have in the country, they're just over 19,000 and just over 9,000 specialists. So given what we've discussed earlier, it's so crucially important that the first point of contact needs to be the person that coordinates care, so that you optimize your resources that you actually have in a way that is not only cost effective, but is made easier for the patient.
Yeah. So Varsha, in summary then, we know that prevention is better than cure. We preach it all the time on the show, but there are going to be cases when we get sick. What's the best approach when that happens?
I think people need to understand that a relationship with a GP is not about, I come to you and I've got the flu and you give me a course of antibiotics and that's the end of our relationship. I'm better and off I go. It's about education on prevention, education on wellness. So when we get to the point where we actually become sick, we've already established a relationship with the GP, understands every aspect of us as a human being, our psychological state of mind, physical wellness, mental wellness.
Family history.
Family history, and the dynamics of our family unit. So I think the important point to realize is that the GP needs to be your partner in your healthcare journey. And your healthcare is not about being treated when you're sick. Your healthcare is about being well.
I love that you said partner, and remember that your GP is not in charge of your health. You're in charge of your health, you're responsible, but he's assisting you, a partner. I think that's fantastic. Think of it this way. A GP treats what he thinks you have, a specialist thinks you have what he treats. Unlike physicians who specialize in treating one particular organ or disease, your family GP is uniquely trained to care for you as a whole person, not just diagnosing and treating illnesses, but doing regular screenings and promoting a healthy lifestyle to prevent illnesses before they develop, just as Varsha said.
For health cover tailored to your needs and pocket, Momentum Health.
I want to live the best life.